get what is happening. The conversation starts now. We actually open the conversation, the floor down to you just to hear these particular experiences. There are particular things that actually come to mind as you are watching this video. You've seen a man who came to testify in a case in which his wife spent 9 hours, after a CT scan had actually been recommended. He had found that his wife was bleeding abnormally. Made noise about it. A CT scan is then ordered later, and then 9 hours later, the CT scan hadn't been carried out, by the time they came to carry out the tests and so on, she was gone. I think some of these things really narrowed down to pure racism, things that actually have historical backgrounds, which would take some time, of course, to deal with. The Hippocratic oath that many doctors take, or health professionals take, actually is to save lives, and therefore everything should be done within their means. It would just be interesting to sort of explore what exactly happens. And I was hoping that we might be able to get, some doctors to probably help paint a picture. Dr. Fatuma, I know you are not a person that works in the wards, but being a doctor probably, and seeing this report, I'm sure you've seen the report in the UK situation. You've seen that in the US, it's actually not any different. In fact, the US is even in a worse situation because it is the country with the biggest maternal mortality rates in the developed world. And that is actually, says a lot. Of course, the US is big. It has a huge population. Probably the numbers could add up. But as a proportion of the population, you can see that the picture is just that gloomy. You are a doctor, and probably you're not talking from the perspective of where you work, but listening or hearing this report, what comes to mind for you? How did you react to this particular report? Dr. Fatuma? I'm sorry for putting you on the spot, because if I see a doctor, then definitely I would come. Dr. Fatuma, are you there? I'll go to Hajat Sarah, who has also worked there while Dr. Fatuma probably comes in or gets ready. Hajat Sarah, assalamu alaikum wa rahmatullahi
wa alaikum salam wa rahmatullahi wa barakatuh.
Well, we've seen the reports, we've heard what's happened in the UK, and they're just very, very similar situations. First of all, your reaction, are you surprised about these figures?
I'm quite shocked, because I thought everyone, when people come here, you've seen people from even who live in Uganda come abroad to have their babies, thinking it's the best safe place to have a baby. So I'm quite shocked with what has been revealed in that video.
You had your own children in this country. Was it just a normal birth? Did you have no?
No, I had them all back home in Uganda.
Back in Uganda, I
had the privilege to have babies in private units, so we were well looked after. There was no problem. But I think it's quite shocking and worrying. Very worrying.
If you see the sort of reasons that have been given, especially for some of the causes, because I just took a screenshot of this, talking about economic stability, neighborhood and physical environment, education, food, and then community and social the contexts, like people living in poor environments, people having access to facilities, even the build up to the pregnancy itself, during the pregnancy, the preparation, attending the clinics and so on, have all contributed in one way or another now to how we end up at childbirth, finding the situation being what it is.
What I would say is, I think in these Western countries, I think it's quite very different. I think everyone, at least we all seem to be in the same class. So whether those rich people may go for private clinics or whatever, but we all use the NHS, which I think should be well balanced. It doesn't matter where you're from, whether you're from Rewisham or whether you're from Chelsea. I would think we'll all be getting the same kind of treatment. So it's quite surprising, but I think they have their own targets. Like one person did say that you think these pharmaceutical companies are there to look after you, but if you're not getting unwell, then they're not getting any money. They're not making money from you. So you have to get unwell for them to make money. So I think it's the same concept behind all this. That would be my view. I don't know, I might be wrong, but I think they have their own agenda. like he's been released in the video.
Now, if you consider the fact that 60% of these things that have led to these deaths are things that are avoidable. I mean, I was reading up on this 5 times more, this charity that helps, women who have, suffered or undergone such traumas in the UK. And they were talking about this woman had her own particular experience. She was operated, so she had a C-section to give birth, after which now she was left, and then the placenta was not removed. So she continued to feel very uncomfortable, complained about it, ignored, went back home. 3 days later is when they come to actually remove this placenta. It was just unbelievable. I mean, what sort of carelessness could lead one to do that?
I think that's carelessness of the highest degree. And I wonder what the antenatal clinics are helping with the mothers, because with us, before we had babies, we knew what we were going to go through. We knew that you'd have a baby and the placenta will be removed, not because we needed to, but we had such kind of education. We were taken through the entire process during our antenatal visits. At least I'm talking about a third country like Uganda. So I don't know what happens here, because I don't think people are that naive not to know that there is a problem, really. Because even if it's your first child, at least you should have an idea of what is going to happen, what you expect, and you should have some education on that kind of, the process and what you need to know about childbirth. So for any doctor or nurse or midwife to leave a mom with a placenta for days, that's unspeakable. Because we know that after childbirth, they attend to the baby, and immediately after maybe stitching you, and even they don't stitch you before they take the placenta out, because it causes massive bleeding. And it has to be out anyway. You'll even get labor pains if you had it like a natural birth. You still get some labor pains to push that placenta out. So it's something I've never heard about, even in our rural kind of settings. I don't think it's ever happened to anyone.
Our rural settings, though, well, you had the midwives, the local midwives, the birth attendants in the villages. I remember situations where they would come, a girl is ready to give birth, they just take her to the banana plantation, put some bitengi around to sort of block our sight. Of course, the curiosity of a child can never be defeated. We would still find peeping spaces just to see sort of what was going on. But you would not imagine, even in that sort of environment, which looked primitive in its own way, that you could end up with the placenta not removed. And in a developed country like UK, to imagine 3 days with the placenta, tucked up inside someone, I think that's kind of gross, even the thought of it.
Yes, it was more deliberate than anything, because I know that the main risks are ladies who help mothers give birth in the rural settings, they may not assess the position of the baby, that sometimes they'll ask moms to push when the baby is been badly positioned, and that could lead to death because they may not know. So for them, if this one is going into labor, what they're looking forward to is to deliver the baby, but sometimes they may overlook the risks involved, or how badly positioned the baby is, or whether it's in an awkward way, as in it won't come out the normal way. So those could be the risks that people face. Yeah, and also over bleeding, where they cannot contain the bleeding. But a placenta being left in mom, no.
It's just
No,
one of those
primitive as they are, they cannot do that.
Now you are a parent, Hajat Sar, and I'm thinking, what sort of advice have you given to your daughter, for example, if the time comes, or she has already had the baby? Have you had a conversation around, what to look for? Because, do they get all the information from the hospital once they attend their antenatal clinics?
Actually, I've never even had such a conversation. I will do maybe today, having heard what is happening, because I assume that this is knowledge they acquire from attending antenatal clinics. And even us, as when we're in school, anyone who has done biology knows something about such things. Wa alaikum salam wa
Walaikum
rahmatullah.
salam, Alicia.
Someone is
Yes.
happy to contribute. I'll give them a chance.
No, they have just come in. They have just joined, and so they did their salam. Finish your sentence, and then I'll go to
No, I think
Alicia.
I'm finished. I
And
was like, I've never thought that things like this could happen. And I know
Mhm.
with our African communities, yeah, they can sometimes fabricate matters because they want to make money out of that.
Right.
Like, so common today to find moms are being C-sectioned
Mhm.
because that's where big money comes from. It's so common in Uganda to have C-section births. So
No,
we know because
but the reason for C-section, especially in Uganda, from what I've been able to gather, is women who, they don't want to go through the process of, pushing. It's too much hard work. And they think a C-section, especially these days, it is not the other ruchindo that is so big. I mean, long time it used to be, they would just, slice a space that is so scary. Look at someone and you want to run away. But they've made it in such a way that now the slicing, the C-sections, that are the manner in which they are carried out is so precise, is so small that it is manageable. So most women now, they think they can just go down that route and they don't want to get bothered.
there are those who want it, but there are many who didn't want it. There are so many
Right.
who have had it done so quickly that they were not even given a chance, and there was no real grounds for doing that. And the
Mm-hmm.
grounds were mainly for money. Yeah, doctors have done lots of things to our young girls today that are quite bad because they want money. I've had a few friends whose daughters were told they will never have children, and they wanted them to go for IVF because it's also an in thing back in Uganda,
Right.
only to find out after a while that they could even conceive when they went to other much more mature doctors, like
Yeah.
gynecologists, yeah,
Mm-hmm.
because these were the young ones who had just come out of school who are so much oriented, and they have done
Yeah.
all the checks that they needed to do, and at least three people or three girls have come out when they could have babies naturally, and all they needed was to maybe be given some fertility tablets, stuff like that, minor things that needed to be done to help them conceive naturally, and they did. So we do
Right.
have a problem of money making back in Uganda, but that's not where we are. We only went there because we are trying to look at what is happening in these so-called first world countries where you expect to have excellent treatment, excellent care, where you expect everyone to have the same service. But so much has gone down really, because even today to get hold of a GP is a big problem, depending on the area where you live. It's a big problem. Yeah.
Right. No, thank you very much, Hajati Sarah. And I'll come to Amir and Alicia, who have just joined us, joined the conversation, listening into that. I'll be coming to you, Amir and Alicia, shortly. Let me first go to Aisha, because I wanted to get someone who has had their children born in this country, just sort of get a sort of a feel. Because I was hoping that Hajat Sarah had at least one of her children in the UK, but it seems like she came with all the children from Uganda. Aisha, assalamu alaikum wa rahmatullah.
وعليكم السلام ورحمة الله
Thank you very
وبركاته.
much for joining us. How are you today?
I'm fine, Alhamdulillah.
I mean,
How was
well,
Eid?
Alhamdulillah.
Eid Mubarak, actually.
تقبل الله منا ومنكم. We are still eating the meat. It's not yet finished. After the doctors clearing that we can eat the meat as blood or.
No.
Okay.
Yes,
Okay.
well, we are discussing a very sort of painful experience for many that will be listening into the conversation. Experience of, women, a report that has come out to say you are 4 times more likely. In fact, by 2019, the situation was worse. You were 5 times more likely to die from pregnancy or childbirth if you are Black, as opposed to, being white, in comparison to white counterpart. You've had your children in this country. First of all, you've heard about this report when you are hearing at least the clip that I shared earlier regarding this report. Were you surprised?
Yes, I was surprised because unfortunately, I'm very lucky. I've never had such treatments.
Mm.
I think maybe I'm just lucky because I've had my babies in good hospitals, I must say. And the other thing is, yeah, I've had all my babies, most of them here, five of them here. And I've had good hospitality, good nurses, good people, good gynecologists, and good treatments
And all
altogether.
of them were natural births, not C-section.
Yes, alhamdulillah, natural birth, 6 of them.
And at no point was there any recommendation that you should have a C-section, because part of what has become also clear is that the number of women who end up, having C-section, which sometimes is unnecessary. And like Hajat Sarah was saying, in a Ugandan setting, it might be about money, because when they do a C-section, you'll pay for that. Here, you just had your natural births and never had a situation where you were encouraged, for example, to go for a C-section.
I was with my last baby. I was offered a C-section because I had diabetes. They said maybe it would be much more easier because the only baby that I was in such a state. But because I have a bad mind about C-section, I said no, I'll try. If I have to stay on the table. Sorry.
No, go on.
No?
Sorry, I think someone did just bleeded. Yes.
Whereby I had to I said I'll give it a 100% go and try push instead of having a C because I don't like it myself. Like I don't think anyone who has had a C is good. They really have difficulties in the end. Like they have whatever, and I'm always scared of having a cut on any circumstances. So yeah, I've heard about stories like people have difficulties. Maybe they're trying to get rid of Black women having so many kids, I should say, because I mean,
you say you've had stories. What sort of stories have you had? Or at least considering the fact that you did not have that particular experience yourself. What sort of stories have you had?
Whereby people are not given good care, like they go in the hospital. Maybe before I go to the stories, myself, with my 5th baby, I went to the hospital and they said I should go back home for a couple of times. Like they kept on sending me away. They said they don't have space, they don't have this, but I'm like, I'm there lating and I'm 5 centimeters. And they're like, no, you have to go back home, come when it's really ready. I'm like, what if I don't make it home? Or what if I don't make it to come back and I have the baby on the way? They were like, yeah, that's the system. We don't have anything. So such small stuff do happen. And we intend to ignore it. We're like, okay, maybe that's the reason as to why. But since that I've seen that video, I think I've changed my mind about it. Like, I know it's just maybe a rest or something. I don't know. But the other stories I've had some friends of mine saying, oh, they had complications day to day, they don't give them care. There was just ignore them, put them in the room and just leave them there. Then you have to call for people, for the nurses. They're all telling you they're very busy. Yeah, but it's not really good. After seeing that video, really, it has changed my mind. I'm a bit shocked.
Quite a lot happens out there. It's quite surprising. It's painful in a lot of ways.
Yeah, it is indeed. Because if you don't know, you never know. But if it hasn't happened to you, you never know. But right now, I've realized, and yeah, it's quite shocking. So I don't know what our kids are going to go through because I mean, but for the Ugandan case, people who say people, but I think all these women that are growing up in the 20th century just like to have a smooth on everything. Everything they want it to be remote. They don't want to go through natural birth. They all want to, oh, I don't want to have pain. So I think to me, it's not only the doctors. If you agree to that, of course, if you said no, let me give it a go, they'll let you do. That's what I think so. So that's my opinion.
I tend to agree because that's the one thing I've had. Like even well, a lot of in Africa now, it's an in thing. Women, for example, there is a whole big debate surrounding breastfeeding. So women will undergo C-section because they don't want to be bothered, and then they will not breastfeed. They just decide because they don't want their breasts to fall. They want to remain in that particular situation. So people are avoiding a lot of the things that should happen.
Yeah, that's what I'm telling you. That is the breastfeeding bit is so much. These kids don't want to breastfeed anymore. And they really I'm surprised. I don't know what happened. If their parents don't tell them, if it's just their choice. Anyway, you never know. They'll still be kids because they read a lot of stuff and they think it's right. These people do hide a lot of information, and for them, whatever they tell you in the books or whatever they write in the books is not what you should take because it's just a written book. Someone just writes to sell and make money. So he has to put in good things and tell you, oh, if you breastfeed, this will happen. Da, 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 da. But at the end of the day, the person who has written the book actually does not do that. I cannot talk about that unless I say it in Uganda, because wherever I am, I can't give much information about breastfeeding. I would have given it, but I'm not in the state of giving about that because it is confidential.
Right.
But I would have elaborated more.
Mhm.
Okujjako nga mbyogera mu Luganda whereby ababitegeera.
byogere mu Luganda biba binatutaasa because I think ultimately twetaaga tubiwulire because we are trying to provide scenarios zisobola okuba nti ziyamba abantu. Let's make that exception then navvuunula because there are a couple of people that are not Luganda speakers, but I'm sure we will find a way around it. Simbula mu Luganda at least onyonyole ekisobola okuba nti kivaayo.
Bamaama ab'ennaku zino abaliwo oba abajja babawa information ze basoma mu bitabo ne mu gundi mu antenatals, right? Ne babagamba te breastfeeding naye nze am a maternity nurse and I work with nkola n'abazadde abayonsa abaana ate bonna nga benkola nabo beeru bafiirawo okuyonsa because bamanyi nti ekituufu omwana bw'omuyonsa immunity, brain wise, everything ekintu ekirina kyo kikisinga and they intend to have bagala nnyo okuhavinga ebintu ebiri nakyo so n'okubasala kwennyini bafiirawo baba baagala babeere nga bagezezzaako at least kigaane bugaane naye bamaama baffe babateera ebintu mu bitabo ne babisoma bo ne balaba nti it's the right thing ate bo bano bye bakola si ebituufu n'abaana bennyini batugamba mu masomero tetukuba baana ate nga baba babadisipulininga so honestly ekyo kyo it's just I don't know ki kye bagezaako okukola naye nga si kituufu ekyokuyonsa abazadde bayonsa abaana because it's the best nze abaana bange bonna mukaaga bayonseza so I don't see they never even when they go to bagenda Uganda their immunity is strong never balwala omusujja at least kale bagola naye ate tebabeera bubi nnyo.
Anti Aisha waliwo issue awo nti waliwo atya agagenda ettaki bagende babaddemu basitule ebbeere nga tagalaba alaba ebbeere lijja kugwa singa anaayonsa
ebbeere ligwa nga tozadde ligwa nga toyonsezza ligwa nga tolina nakyobadde nga oli muwala I believe bw'oweza emyaka 25 ebbeere liba lyagwa dda nga teringa bano bannabbiira abali 21 or 20 nerye nabbiira nalyo leka lyavaako dda kati mbasaba kikyotaasa it's just abantu babeera bali gundi tebategedde butegeezi tebafolowinze nnyo bano abantu bye bawandiise wadde bye batadde mu bitabo ne batabbo ne bateefaako bamaama baffe baayonsa amabeere gasigalawo nze kennyini ayonsezza era ngeri kyaliwo bali gudde batali gudde anyway me I don't mind I do nkola ekisinga obulungi kyensinga okukola kubanga bino byonna byenkugamba abantu bano tebafaayo ku babeere gaabwe be basinga okuba ne ssente naye ate era tebagenda sajja ezo sajja tebazigendako bafuba nnyo okwagala okulaba nti basindika okusinga okubateekako ebiso kubanga bamanyi ekiva mu biso si kye kirungi ennyo.
Amen. Thank you very much, Aisha, for that very detailed explanation. Very much appreciated. If you've just joined us, this is Come Let's Talk with Kassim Kayira. We are live on 75W Radio. We are live on Umma Connected. We are live on Facebook, on Zoom, and on YouTube. The conversation tonight, Black and Pregnant, reporting is showing that you are 4 times more likely to die during either pregnancy or childbirth. 60% of the reasons for that could be avoided. And therefore, the reports just stop short of mentioning the fact that it is down to racism and not actually these natural factors, especially considering that that's a comparison between white as opposed to black, whether it's their natural environments and so on. Hafswa in the chat room, you're saying, but in Uganda, many private clinics encourage C-section so that the bill can go high. I think that was raised by Aisha as well. But also sometimes young women go for C-section so that they can stay intact. I think that's the argument. And Aisha is saying, well, you are opening yourself now to trouble because I think you can only have a maximum of 3 C-sections. Otherwise, beyond that, it will be risky for your life. Unless nowadays, I think with the with the advancement in technology, the way I see the kind of cuts, the size of the cuts has become thinner and thinner. Probably the doctors could tell us if that has made it much more easier to be able to do that. Dr. Fatuma, I'd like to bring you in here, please, just to sort of get your own take. We won't mention the hospital that you work in, but just for purposes of informing the conversation that we are having tonight, as a person who is in the profession, hearing this kind of report, I'm just wondering, how does it ring? How do you feel? Is it something that you think is true? I mean, because this was done quite extensively, and it's not the first report. The first report came out in 2019, and then 2022, another one was done, which has just been released in 2023, pointing to the same fact. The only difference is it was 5 times more likely during the last report. It is now 4 times more likely. So you are still able to die, 25% chance of being able to die through childbirth or pregnancy. Dr. Fatuma, are you there? I'll cross over to NK. NK, Assalamu alaikum wa rahmatullah. I think Dr. Fatuma is still taking notes there. NK, Nzejori. Hello, NK. Assalamu alaikum wa rahmatullah. Mzinda rugwade guganyo kusumuruka. Subhanallah. Okay. Well, just a quick one, maybe 1 minute, 30 seconds. It's just about this report. The way Black women, you are more likely, you're 4 times more likely to die during pregnancy or childbirth. Are you surprised at all?
Not a bit. You will never shocked. And I see about the first time.
Right. No bako chochikoze chonna. At least kuba.
Yeah.
Okay, well, put the one answer, but this went now before letting you disappear into work. All right. Okay, that's fine. Thank you very much. Hafsa, assalamu alaikum wa rahmatullahi wa barakatuh. You just put a message in the chat room regarding the C-sections in Uganda and how the purpose or the intention behind that. Hafsa, are you there? I'm trying to get you to unmute yourself. Hello, Hafsa. Kanumbe. Oh, there was Amir and Alicia. Let me see if they are available. Hello, Amir and Alicia. Assalamu alaikum wa rahmatullahi wa barakatuh. You came on and gave your salam and then disappeared. Hafsa, yes, I got your message in the chat room. Sorry, you can't talk at the moment. Yes, but if you are listening into the conversation, if you've just joined us, the program is Come Let's Talk with me, Kassim Kayira. And tonight we are talking about the challenges of being black and pregnant, the likelihood that you are 4 times more likely to die in pregnancy or during childbirth, resulting from all the different aspects. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Sorry, I've joined late. I've just left work.
Yes, I've just seen you joining, and I knew, but I knew I would still run to you because trying to get more engaging. But I'm sure this is not the first time you are hearing this report and what's come out of it. 4 times more likely to die during pregnancy or childbirth if you're black, as opposed to if you're white. Did this in any way shock you? Probably the first time you heard it.
Yes, is that in the UK?
Yes, that's in the UK.
I think it was shocking, but at the same time, I don't think I think studies had to be done anyway. There's a lot. It's not only, I don't think it's only even actually in childbirth. There's a lot is going on now with difference between black and white people at the moment when it is regarding health.
Right.
Yeah.
When you say a lot, I mean, in what sort of area? Well, let's try pregnancy, the kind of treatment that Black women receive? Because from the report, it was quite, interesting to see how there's neglect, the feeling that Black women can take pain. That statement for me was actually, it was difficult to contend with. The fact that Black women can take pain, and therefore, even in situations where you could have received help, you end up not getting the help that you would have received simply because the assumption is you are able to sustain, you are able to contain the pain.
I really don't know. I really don't know why they thought that we're able to sustain the pain. But I sometimes also blame this onto the culture as well. There's a lot of cultural differences that are actually embedded in this as well. Especially women in pregnancy. You do not do this, you can't do this, you don't shout, you don't scream, you don't say you're in pain. Then all these misconceptions, you can't have an epidural, don't ask for an epidural, you're going to get back pain, you're going to get this. So all that, and the negativity that you're Black, you won't get this care. We are very timid people as well. You fear to say, you fear to ask. I think this has to be involved in all this.
And actually, I think you are sort of taking us into an interesting territory, which probably the report might have actually did touch it, the cultural aspects. You consider where we come from and how women, for example, would be treated when they are pregnant. You see, like in Uganda, let's use Uganda as an example. You go to hospital, you are pregnant, and the manner in which sometimes you are treated in itself starts building up the thought that at the time of giving birth, the traumas that are sort of mentioned around pregnancy make a lot of things taboo when they should be in normal stuff.
Yeah, it's that, because I know that is there as well. Like if you're in pain, you can't say you're in pain. A woman has you. It's like it's something you have to go through. You have to go through this pain. Yeah, it's really mostly cultural. I think it's the way we've been brought up as well. That if you're in pain, you can bear the pain, you'll be fine. No one dies. No, that kind of thing. It is just a short while and stuff like that. Then there's also a bit of, I'll take it as negligence. We don't like to go for clinics as well. I would prefer to work instead of going to clinic. My baby's fine. Actually, the baby's not fine. You have to go for clinics. So these are things that obviously, coming from an African background, you never see your people going to clinics all the time like they do here. You find all these checkups. Why are you having a scan for? You want to know the sex of your child. Why do you want to know the sex of your child? And meanwhile, it's not only that you want to know. There's checking. They check for the abnormalities before from 20 weeks. So, but it's that. What can I tell? Some ignorance involved.
Yes.
Yeah.
But the report also mentions and brings out an element that even in situations where they have not spoken, I take that. I do agree that there's in many cases that the culture comes in that women won't speak up. But even in situations where they've spoken up, they've not been listened to, and that became an issue of concern. A woman comes and complains about the very pain that you're talking about, and it's taken that probably they can stand.
That you're not in pain. They'll say you're not in pain, you're okay. I know that is there as well. That is, unfortunately, I don't know what to do or what to say about that, but that is in hospitals for you. So it's how women are being treated, actually. It's not only Black people, even the other.
So what should someone do? My wife is crying of pain. We are in hospital. We are speaking to.
You have to stand up. I always tell people you have to stand up. You're in pain. If the midwife or the nurse you're looking after you doesn't seem to be concerned, ask to speak to your senior, ask to speak to someone else. Obviously, they will now take it serious. Don't just keep quiet. I always tell people you have to speak up because I can't judge your pain. Kassim, you might be in pain and I'm seeing you might be smiling, but you're in pain. I can't say, oh no, he's not in pain because he's smiling. You might be in pain, but who am I to say you're not in pain? I'm supposed to listen to you. I always tell people you have to learn to speak up. You have to talk your mind.
Now, we've had one, as part of the report, there was this very painful experience where this woman, I think, was operated on. Well, she had a baby, and then the placenta was not removed. She was just, put back together and then went home. She was complaining of pain. Nobody bothered. I mean, she did raise the concern. 3 days later, they find that actually the placenta had not been removed. This borders on criminality. I mean, this would almost, cause a special investigation to be carried out, especially, like in the hospital where that happened. But if someone had raised a concern like that, in other situations, some of the women end up dying. There are some that might not be able to make it to hospital, especially considering, many who get sent away from hospitals. These days, you go to hospital and there are times when you are pushed out of hospital. They create a situation that would sort of, force you to leave. And with that, some people have died as a result. That's absolute negligence.
Yes, that's absolute negligence. I haven't had that report anyway, but the issue is definitely, I'm sure there was a lot that happened after that. Whoever the obstetrician was, who performed that C-section, leaving a placenta in, everybody that was in theater that time is actually accountable, because these are the things you look for. And the midwives around, you have to ask, is the placenta around? Because they even take the blood samples from the placenta. So I'm wondering, what did they do? They missed a lot of stuff. So it's not only leaving the placenta, so there are many steps they didn't do. Unfortunately, I'm not a midwife, but the little training I did in my training as a nurse, getting into nursing, I did a bit of midwifery as well, went to labor. But I know they do take blood from the placenta, from the cord as well. They have to check the placenta as well, that it's intact. So there's a lot of negligence that happened there. So I'm sure, I don't think that those people stayed. I'm sure there was off.
Have you had all your children from the UK?
I've had all my children from the UK, but they're normal deliveries.
Normal delivery, and the way you are treated, because probably you are in the health profession, you received
with my first, I wasn't in the health profession actually with my first son, but actually I would say with my first, I had the best treatment than from my second and my third. My third, there was a bit of hoo-hoo-ha. They didn't know I was staph. When they found out I was staph, it was different treatment. But I was even giving birth in my own trust. That was the irony about it all. But the treatment we got in our first, then I think pregnancy, and it was good. The checkups they were doing were very good. You wouldn't leave hospital until you know how to bathe your baby and stuff like that. The aftercare was marvelous. From my second, that's when things started going bad. It became a bit different. You had to stand up for yourself, actually. My third as well, then obviously.
What was different? Had you moved trust?
No, I was in the same area. So I was in the same area. I didn't move trust. So I was in the same area, but that hospital closed.
Right.
The hospital I had my first one closed. So then we only had 2 hospitals. So all this definitely shebang. There was a lot. This one when I think there was a lot of cases going on. Then with my third, that's when they realized there was a lot of issues in maternity as well. But still, the aftercare was horrible, very horrible in the hospital. I
would need a little bit of detail on that, Nilfa, simply because tonight, given what we are discussing, and especially looking at, probably trying to find a way forward, a way that we can, avoid this. How do we get around that? What exactly happened? Just a little bit of detail in terms of the too much that was going on. That wasn't
okay.
Right.
So with my third, that's where the problem was. Anyway, I was a high-risk patient with my third following my second delivery. So with my third, I was classed as a high risk. So I had to go to this big hospital to have the child. So obviously my labor was quick, mashallah. It was quick. It was nothing. It was very, very quick labor. But I know by the time I had baby, so it was the aftercare. I'm taking from the labor ward. Labor ward was fine, quick, everything. I'm now going to the labor ward, the ward after, whereby I was supposed to be put in a room. When I left labor wards, the midwives knew I was going to have a side room. This was prepared before. But when I got there, and unfortunately, these are Black people doing this to Black people. This is where the problem is. It's never the white midwives. It's usually, I'm sorry to say this, but it's a fact. It is the Black, our own people who act in such very bad. Anyway, so I went in. At the minute I'm wheeled in, they say, "Oh, where is this person's room she's going to?" And the midwife was like, why is she going to a side room? She's not going to go to any of the rooms. Those rooms are for special patients. She's going to go in the bay. So I said, fine. So I told the midwife who brought me down, I said, no, leave it. Now she knew I was staff, but she didn't tell the colleague that I'm actually staff. I said, no, leave it. So I went into a room and there was next to a lady, first time mother, baby is crying. I even forgot my own child. Baby is crying. She's had an epidural and this midwife is shouting, feed, get up and feed your baby. You're supposed to feed your child. This girl cried. So I now got up, like I was like a thief actually. I went to her and I said, my dear, what's the problem? She said, I can't even feel my legs. I said, did you have an epidural? She said, yes. Then I said, okay, let me move baby next to you. And I put her on your nipple so you can let baby try and latch. So I did that, but she didn't even know. She was a first-time mother. So I did that. Now this lady came. In my first time I ran back to my bed. I was that scared of her as well. So I quickly ran back to my bed. She came to do my blood pressure. It was now 180. She asked me, why is your blood pressure high? I say, because I'm scared of you. Okay.
Wow.
So
yes. And how did she respond?
She just smiled. She didn't care. She just did not care. There was no empathy with this midwife at all. No empathy at all. So in the middle of the night, this is why I said, I don't know why she was not clicking that I was staff, because I had staff come from other wards to come and see me. Yeah. But I think she thought I was just a friend. And I wanted painkillers. Then I asked for some paracetamol. That was also a struggle to get the painkiller from her. So I just called upstairs. Someone came, gave me paracetamol. I took the paracetamol from a different ward. In the morning, now the staff come in. Fortunately, one of them is actually a Muslim sister, Ugandan Muslim sister who knows me. And they were all like, what are you doing here, Nilfa? You're supposed to be in the side room. I said, this so-called midwife said I'm not supposed to be in side room. It's for special people. So the manager then was in there. They changed everything, quickly wheeled me in. Then I said, but why are you doing this? Because I'm staff, I'm having special treatment. I don't think I should have special treatment. If this is how people treat people, no wonder we are in this trust with the maternity. Then I told them what happened. So she went home, she comes back, she finds me in the side room during the night. Then she starts telling me, why didn't you tell me your staff? Why didn't you tell me this? I'm like, excuse me, my sister, you do not treat people like this. Whether I'm staff or not, you do not know where I come from. Yeah. I've had a child. I need help. You're there to help me. That is your job. So these are the kind of things I think the midwives as well, our fellow nurses don't have empathy at all. It's also got to do with our own Black people as well. So if you've got no one to speak for you, that this is how things go, it is very difficult. So sometimes we're to blame for our own problems. That's how I take it.
No, thank you very much, Nilf. I think that's quite insightful. It takes us into what happens into those rooms that sometimes we won't be able to do that. In the US, actually, what they've done is they've got some people called, I don't know whether I pronounce it right, they're either called doulas or dualas, and these ones come in to be there to speak on behalf of the patient. They sort of try to push for your rights. And I think we will play a clip later on, just to sort of try and show how much of a difference actually this makes. Ibra, we've got our clip number 2 here. Hafsa, I think this was cleared. Therefore, we shouldn't have a problem with the YouTube copyright. If we do, then it will be my hand to be slapped, but I think I cleared this. Ibra, if we can have our clip number 2, please, just to sort of help explain and expound on this. If you've just joined us, I think you've just joined at the right time, where we're just getting a very powerful testimony from Nilfa in terms of experience in the labor ward, where, whether being staff can sometimes help. If you're not, then you know what would happen to ordinary people. It happens in some hospitals, not in others. It happens with some people. And the painful revelation, I think, that has come out of this now is Black on Black, because we're talking about racism, but it might be racism that is, well, if it is Black on Black, I don't know whether it still constitutes racism, but there is unfair treatment in terms of this. Ibra, if you can have clip number 2, please. And The program is Come, Let's Talk with me, Kassim Kayira. It's 26 minutes past 9 o'clock. We are talking about the topic of being pregnant and being Black. This new report that is saying you are 4 times more likely to die during pregnancy or childbirth. You see Nilfa's experience here. She's had normal pregnancy, normal childbirth, and then postnatal care is where all the problems start appearing, and some women have died in those particular instances. Ibra, we are ready. Yes, let's just play that clip, please.
Picture of health today.
They've got me running.
Rewind the clock to 2014. Shanae, 32 weeks pregnant, thought she was going in for a routine appointment. A quick check of her blood pressure, and nurses put her on her side. She was suffering from severe preeclampsia.
At that point, it was stroke level. They were concerned that I was going to seize at any moment.
The only cure, deliver the baby.
3 pounds, 1 ounce. She spent 1 month in NICU.
An extremely scary time for Shanae, one that would repeat itself 4 years later.
And it was like deja vu.
But this go around, even worse. Shanae developed severe preeclampsia 6 weeks earlier than her previous pregnancy.
When Emery was delivered by emergency C-section, and it was a very traumatic experience in the way that she was delivered.
Her baby's heart rate plummeted.
She was in severe danger at that time.
But so was Shanae, her new doctor telling her bluntly there was a chance she could die.
And that's how he said it. So no compassion at all.
In a turn of events, Shanae's OBGYN came in, stopped the emergency C-section until it was safer to perform the surgery. Her daughter Emery delivered at 1 pound 3 ounces and spent 3 months in the NICU.
I'm convinced that had things gone in the way that they had initially planned, I don't think I would have woken up from the anesthesia.
Shanae's experience is all too similar to other Black women, but it doesn't always have the same outcome.
Pregnancy associated versus pregnancy related.
Dr. Gloria Richard Davis says institutionalized racism is the foundation, and it creates more problems.
Oftentimes, women try and communicate to their patients, to their providers, right? That something's not quite right. They may not know exactly how to convey that, but they know something's not right. And oftentimes they're brushed off.
This was the case for Shanae.
I shared with my doctor that I wasn't feeling well, and it was sort of dismissed as, oh, well, you're pregnant.
Other factors that have a hand in why Black women, specifically in Arkansas, have higher rates of maternal mortality. Where in the state do they live? Do they have underlying health issues? Dr. Chriselle Nash with Arkansas Blue Cross Blue Shield says Arkansas is severely underserved medically.
If something happens acutely and you need to get care, you're trying to get to an urban center, to a UAMS or other institutions, and that can have an impact on your health outcomes.
Studies show that of the Black maternal deaths in 2020, 92% of them were preventable. It begs the question, what's it going to take?
And so by doing research, you're able to give them those numbers.
As Dr. Claire Brown breaks it down, it's a tier approach.
A policy tier and the individual tier. There's a middle tier, the healthcare provider level.
The individual tier is all about women and their support system knowing the symptoms that could lead to a severe maternal event. Then, health policy. A big push now is Medicaid expansion.
By having Medicaid expansion, women who are low income are able to have insurance prior to their pregnancy or in between pregnancies so that they're able to get those conditions under control. They develop a relationship with the provider.
And finally, health provider level. This tier requires hospitals and doctors alike to do the work to create culturally aware spaces.
Having that awareness can ultimately allow for a provider to help treat their patients kind of better.
3 important points that these doctors say will help protect expecting mothers, especially ones at a higher risk. A risk Shanae knows all too well, which is why she urges Black mothers to ask questions and don't be afraid.
Well, that's another pretty grisly example. You can see what can actually happen, what could go wrong in situations that look very normal and then they suddenly become very abnormal. We are talking about being Black, being pregnant, 4 times more likely. In the US, it is 3 times more likely. Actually, it was 5 times more likely. And the cases just, keep coming up. Of course, there are reasons behind this, and the personal experiences, I think, speak louder than in any other way, in other form that we might be thinking about. So tonight we've had very compelling examples, some positive, actually, where they've had very good experiences, and some not so positive. I think, let's try and expand the conversation to more people, just to hear your own experiences. It would be good to hear. Dr. Fatuma, I'm still hopeful that we might be able to speak to you. Let me come to Asia. Asia, assalamu alaikum wa rahmatullahi wa barakatuh. Hello, Asia, are you there? Hello, Asia. I'm trying to get you to unmute yourself. Asia or Shadia. I think I didn't get any chance with the... Hello, Asia, are you there? Or Shadia? Afsa was at work, so couldn't speak. Let me go to JD, Mr. Jaden, who joined pretty late in the conversation. Abu Afra, your microphone is not on. It would have been good to hear from you. You've been around, but you are actually, your mic is not on, so unable to get you to speak. Mr. Jaden, I can see you disappearing. Okay, let me go to Abdul Karim. Jaden is back, and then I'll come to Abdul Karim. Abdul Karim, I'll be coming to you shortly. Let me go to Mr. Jaden first. Jaden, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
How are you? And thank you very much for holding fort of the program while I was away. We are back and launched back after Ramadan. How is the family? Hello, Jaden.
The family is okay, alhamdulillah, right? Hello.
Yes, your sound had disappeared there.
Yeah, I've got a very bad network around where I am. So I was just saying, let me thank all the people who supported us during the time when we were away. And it's not an easy task, an easy job that you are doing, but you are managing it well. And sorry I'm late for
Yes, no, I saw you coming in and you are bleeding in and out, and I could notice both times as you're trying to come in. Well, you've had all your children here, including the twins, here in the UK, I would imagine.
Yes.
And listening to this particular report, looking at this particular report that is saying being a Black woman, most likely 4 times more likely to die during pregnancy or even childbirth. How did that play with you? What's your reaction to that?
I think it is sad that the sister had to go through that. And my experience here in the Northeast was completely different. It's a different world, because at the time when we came, there was not many Black people in Newcastle. And when we realized that we're expecting, then we started, not me, but the mom started attending the clinics. And
did you attend at all?
No, but lucky enough, Newcastle, they've got the outreach service and the midwives. If you fail to attend one session,
they'll come to you.
They would come to you.
Yes.
So you're better off going there where all the facilities are, as opposed to the midwife coming to your home. But that was there. So my issues were not with the pre-care or even the care itself. It was the post-care which is normally the problem.
Right.
Because with the pre-care, I've already mentioned the issue of midwives coming to check, the regular weigh-ins, the blood checks, and so on. And if somebody came from Africa at a time when they're doing those checks, they would imagine there's something seriously wrong with the pregnancy. But these were just routine checks. And like the sister said, it's to eliminate any issues of genetic disorders or any abnormalities, so that they catch it early, but not to check the sex of the child or things like that. So and then when the actual day came, we learned that it was going to be by C-section, and I happened to be in the theater, and my God, you've never seen a busy place like that. You know, they count from the gauze that they use, the needles, the syringes, they count, and there's somebody chalking it on the black, on the whiteboard, just to make sure that everything that comes out of the cabinet goes back to the wash tray. So when I hear people say, or they left a gauze, or they left a pair of
scissors, sometimes it's
scissors or something like that, that really says there was negligence, because there's not one person. To be honest, there was at least 8 people I counted in that room who were publicly stationed in the room. I mean, in the operating theater.
Was
and
that with the
those
bath
who were
of the
coming
twins?
in and out.
Sorry,
Yeah, this is the
was
bath
that
of
with
the
the bath
twins.
of the twins, or just the other?
This is just the twins.
The twins, okay. Yeah.
Yes.
Mm-hmm.
So it was so methodical that I felt comfortable, because I didn't want to see the gruesome blood here and there. But I said, no, you sit here, we're going to make you comfortable. You hold her hand. You're not going to see all this, but just see what goes on in the place. So you are part of the care. And I was really impressed. And if anything happens during that time, then you know it's not human fault. It's down to something else. It's either the machine has failed, but the human input is so thorough, the build so systematic that nothing can go wrong.
Now you mentioned being impressed now, but at that particular moment in time, what was going through your mind? How are you holding yourself in there?
I was scared. First of all, the number of people. I've never seen so many people attend to one patient, and all dressed as if they are going to the moon or to Mars, you know, all so there was that scare to begin with. And then when we come from Africa, we have the perception that childbirth is dangerous, and it is dangerous because women die there. So we still come with that mentality that something is going to happen, and because there's so many people in the operating theater, something definitely is going to happen. But these are the precautions that they put in place to make sure that nothing happens. And then when it came to the post-care, when we're still within the maternity ward,
yes,
again, the staff were so systematic. We actually did nothing. They don't come and pick the twins, go and wash them. When it came to feeding time, they would come and pick them, go and change them, and do all kinds of things to them. So we're just like guests in a 5-star hotel. The food was fantastic. The visitors were allowed, and this was a general ward to begin with. And then,
but you say the problem is around aftercare. Sorry, I just interrupted your flow of thought there, which I think I would have left you to finish there.
Yes, the problem started when we got moved to a side room. That's where the problem started. And you get forgotten about. You are ignored. When you call for attention, it's like you are seeking for attention when you actually need paracetamol, for example. So that's where the problem started. And then when we got released, because at the time we're in a 1-bedroom, not really, we're in a studio house, and we wanted to change. So the problems followed us from the hospital right through to the social care aspect of it. Because if you are in such a situation that you cannot manage, alhamdulillah, we managed at the time, but if you are in a situation where you cannot manage, or if you're a single parent, then things like infection and aftercare wounds not healing will follow you at home. Because once you are out of the hospital, that is not their problem. The problem now turns to social care and extended families and the networks. But the other thing which I wanted to point out also is, I remember during my childhood, the sisters who follow me are twins, and the stories that my mother and my grandmother told me is that because they were in the
The line is dropping out there, Jadine. Please come back again. Yeah, you're saying there were what?
Yeah. We are living in the reserve at the time. So the maternity was not anything to be called a maternity ward. Because
when you say reserve, is that a park reserve, a game reserve?
In the countryside.
Ah, right. Yeah.
Sorry, my line.
Yes, your line is dropping out. You're saying you are in a reserve. You are living in the reserve, and the maternity was not anything to write.
Sorry, my network is not so good.
No, but we can hear you now. It's slightly better.
Hello.
Hello, Jaded. Yes, we can hear you.
Yes. When I say, yeah, when I say reserve, my father at the time was working in a very rural area, very much out of what we call hospitals. You wouldn't call it a dispensary, but they had facilities to help the rural people to with healthcare. But at the time, my mother came out of that facility. You would expect infections, you'd expect poor post-care and so on, but nothing like that happened. But now in our 21st century, you'll find women coming out of Mulago and Nairobi hospital with infections. And you are asking, is it our genetics that has become so weak that we cannot handle pain? We've become so susceptible to bacterial infections. And yet we've got everything, all the hygiene that you can think of. And yet people still come with post-operative infections. So have we just become weak, or is it something which we are missing around down the line? If you look at my care, I had an operation about 12 months ago, and it was the same process. At the hospital, everything went smoothly, the operation went well, and then the post-care became a problem. But again, I can't fault the Newcastle Hospital, the NHS Trust in Newcastle. Whether you are Black, whether you are Asian, whether they treat you, actually they treat you as a number. They don't know who you are. They treat you as that number. And sometimes they say, you are treating me as a number. People think that is wrong, but they're not looking at the color of your skin, but they're looking at your number 65541, something like that. So if they're sending something from the stores, this is going to patient number 65441, they are not sending it to a Black person, or they're not sending it to a white, they are sending it to a human being. So when we say that there is discrimination or things like that, it's at that point of delivery sometimes where the discrimination comes. And that sister said it's the fellow Blacks who do it. But the people who are in the background, the consultants, the pediatricians and so on, they look at you as the number. This mother has got this problem. What care does she need? But they're not going to say this person from Chankwanzi or from this place needs this kind of care. No, they look at you as the human being who needs the care. And if anything goes wrong, then it goes wrong at that point of delivery. Somebody doesn't hold the pair of scissors correctly, or somebody doesn't apply the correct dosage in the syringe. That is where the problem is. But from the point of your need to where you actually get it, I don't think there's a problem there.
Fantastic. Thank you very much, Jaden. It's a quarter to the end of the program, 10 p.m. This is Come Let's Talk with me, Kassim Kayira, the launch program post-Ramadan, the first program post-Ramadan. And we are talking about the difficulties, the challenges of childbirth and pregnancy in the developed world. Well, UK, based on this report, but then you realize a lot of nearly the same situation, worse probably, because the US is actually the country with the largest mortality rates in the developed world. But of course, probably it has to do with the population as well, the size of the population. But ultimately, there's Black involved. There's that situation that we have to put up with. But from the experiences that have so far come in, other than a few exceptions that you see, it looks like during pregnancy, probably a lot of care is there. post-childbirth is actually where probably we might have a situation. Abdul Karim, I come to you. Thank you very much, Jaden, for sharing that particular experience. Abdul Karim, are you there? Assalamu alaikum.
Wa alaikum salam.
Good evening and good to have you on the program. How are you today?
I'm fine, thank you.
We've just had the testimony from a man who went into the theater and was panicking. Well, I was there when my twins were born as well. And even with the second born, I was in hospital. The first born, I was away on work mission. But second born, I was in hospital. But if you could see me, the manner in which I was pacing down, up and down the corridor of the labor ward, hardly able to enter in just to sort of see. I failed. I was just pacing around the corridor with my heart beating as if I was the one having the labor pains. But with the twins, I ended up having to be there because it was C-section and I didn't know what the outcome would be. It looked like it was normal care. I haven't faulted the hospitals. I didn't see anything that came across as being that. But sometimes probably it might be that it's the cultural aspect. I think someone, one of the contributors did mention it, that there is the cultural element. We come from backgrounds where we've suffered so much that sometimes you don't even notice when a suffering or something unusual or abnormal, what would not have been done to, say, a white person happens to you. What has been your experience? First of all, hearing this report, I'd like to hear your reaction. Hello, Abdul Karim. I think the network is playing up. Abdul Karim, are you there? I can see you, but then the line seems to. Right.
Yeah, yes. Hello?
Yes,
Yeah.
Go ahead, please.
Can you hear me?
I can. Yes, we can hear you.
Yeah, unfortunately I've not experienced the theater environment, the theater or maternity environment.
Mm-hmm.
That's the unfortunate part of it. So I won't really be able to comment on it, but what I can say is I've experienced someone being administered epidural and I almost fainted. So I really feel sorry for our sisters, mothers, and aunties, the pain they go through. And to be frank, me, I can't stand it. We've ever spoken about this one, and some ladies were commenting, "Oh, that's lack of love, lack of care." But to be frank, I can't be in there because it's unbearable.
Yes.
Yeah, and it's unfortunate. I don't know whether the research is based in the US.
No, it's the UK. It's just the clips. We had a very nice dispatches that was done by Channel 4. We had a very nice dispatches that was done by Channel 4, but because it was very, very critical, that particular documentary has been removed from YouTube. You can't see it if you try to get onto the link. So we've ended up getting a lot more footage from the US, but this was done in the UK. And it's just been shared in the chat room, if you see, done by the MBR Race Stroke UK. And they have been releasing reports on maternal morbidity rates since 2016, shedding light on the racial disparities that exist in maternal health care. So the 2020 report now did inquiries into maternal death and morbidity, revealed that Black women are statistically 4 times more likely to die during childbirth than white women in the UK. This is the 2020 report. So it was done in the UK.
All right. I've not had a glance on it, but to sum it up, it's very tormenting, and traumatizing to be inside there. And I credit fellow men who can stand that experience to escort their wives and the partners into theater and labor.
Yes, many men are lazy. Actually, when your wife is even going for the antenatal clinic, many men tend to say "genda na kuchima," and they do not partake in the process, they just feel like it's not their business.
No, I have a weird experience. I would say perception about it is like I don't know what other people see, but somehow that someone's private is really, is really much as they're doing a duty of care to save life, but I see that the privacy of either the patient is not catered for. That's what I perceive in the whole scenario.
Yes.
I don't know what other people think about it, but that's what comes in my mind. Like, oh, let's say, oh, this is my wife, and now there are like 4, 5, 6 surgeons, and they are looking at a naked body. That comes into my mind.
Abdul Karim, we are talking about a matter of life and death, and you are worried about doctors or medical professionals being in the room, treating your wife or helping her to deliver.
Yeah, I understand, but this all comes into my mind. That's why I say that's my personal perception. It's like, really? Is this how it should be? I don't know. I find it unfair.
Would you go into a theater, or you wouldn't?
No, I can't stand it. I told you.
Okay. Much appreciated, Abdul Karim. And thank you very much for your time. I just got a message into the chat room. Dr. Fatuma, due to current commitments, can't come in, but she's shared that particular link. So anybody interested in this report, the details of the report, you can just click on the link and you should be able to see the amount of details that have come in. Nilfa, your hand is up, and you come in again. Is it about men fearing to go there or escorting their wives into...
No, actually, I'm
Yes.
just going to comment about Mr. Abdul Karim's, what he said about the men thinking about that perception he has, people looking at his wife and stuff like that. Actually, that is one of the hindrances as well. And this comes with the culture. We get that in hospital as well. Some woman has come, she's really critically ill. She's come with her husband, she's due to deliver. Now the man is saying, no, I want a female doctor.
Oh, yes, yes.
It has to be a gynecologist, has to be female. Meanwhile, it's an emergency. You have the obstetrician going to perform this is a man. So all this is also part of this.
The culture.
Part of the culture.
Yes.
This is the hindrance. So these are some of the problems that these guys are facing.
I remember, Nilfa, we had a sheikh during our school days at Bilal. Actually, he would go whenever the wife was going like for gynecological appointments, he would just go there and sit there. And well, you can't determine which doctor you get because there's a shortage of doctors. Well, you can imagine what that means. Once he would say, a man who shouldn't touch his wife, and it became an issue because there would only be male doctors available as gynecologists. And it would be an issue. The wife would go back and she had particular complications, not necessarily related to pregnancy, but gynecological issues that would have been dealt with.
Yeah, I know. And this is actually, I'm telling you, it's a problem. And to tell you the truth, I work in the NHS. I get a patient like that. I'll say, okay, let's hold on. Let's wait next patient until we get, that one goes back on the line. It wouldn't be my concern because at the moment we're up to numbers. Everybody has to move. We've got to move. I'm not going to sit and plead and explain and do that. So this is what is happening. So there's a bit of ignorance. There's a lot of health promotion that has to go on. There's a lot, I don't know. But these are some of the issues that we're facing. When it comes to the white people, obviously they wouldn't care, the Caucasians. A doctor is a doctor, a consultant is a consultant. There'll be a chaperone. Because at least you ask, let me have a chaperone. Let someone be in someone female, even though it is not this.
Who is a chaperone, please, Nilfa? You're using medical language.
Can be someone. So it's especially, let's say it's a male doctor going to see a female.
Yes.
Or you ask, no, I want a chaperone, because obviously anything can happen.
Yes.
So even the doctors themselves say, no, can I have a female chaperone in to see what is actually going to happen? So it's someone to stand in. like a witness for whatever you're going to do. So we offer these for people like that, but they still will say, no, 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 no. I want a woman doctor.
When it's a matter of life and death.
Yes, that's the issue. That's the thing.
All right. Thank you very much, Neil, for that intervention. Abu Afra, I would really, really want to have you, make a contribution to this conversation. Your mic is not on. I don't know if you can log out and log back in. Your mic is not on, and you've been part of the conversation from the very beginning. Even brought the salam in the chat room that I'm unable to get. It would be very interesting to hear men's views on this. And it's quite interesting. You've had the issue. Someone comes in, Abdul Karim comes and says he can't manage to be in the labor ward. He can't stand that. The thought of, the number of 8 people standing around his wife, but also the fact that it is also the fear, the panic. And I've just shared my own experience where I had to pace up and down with the second bath, and I couldn't enter into the labor ward. My heart was beating. Actually, men are very cowardly in some instances that while we might be macho in a lot of other ways, when it comes to some of these things, you see someone, especially around that time of, the pain, it can actually be very, very testing for many a person. Hafsa, we've had a lot from the US, and just in terms of the clips that we have played, I would like to get your own view from the US side of things. You've had your children from there. Hafsa?
Yes, Sheikh, take it.
Naam, salaam alaikum. You've had your own children. I mean, hearing this, because you would have thought following this report that this is a UK situation, but no, actually all the clips we've played are from the US, and they all point to a similar situation. What has been your experience? Have you had children? Have you given birth in the US? What was the experience with the pregnancy and then even childbirth?
Sheikh, I have never received any problem. I have never had a problem whatsoever of discrimination or anything. I remember a time for when I was pregnant with my second daughter, my water broke. I tried calling the hospital. That I was like, I wasn't sure if the water, it was too early. I was like 35 weeks. So my water broke, and I was like confused. Is this okay? Is this water's broken? It was too early. But I called the hospital and I couldn't get, the numbers were not going through. So we had to drive to the hospital. But when I went to the hospital, I said, I've been trying to call you. The lines have not been going through. I was scared, blah, blah, blah. I will tell you that I spent a week in hospital because of the risk that I had. Mm-hmm. But every day I had the social worker come and tell me, we are very sorry, what happened? What exactly happened? Questioning me, what can we do better? I was like, okay, enough of it.
Yes.
I mean, it happened, something was wrong with the lines, but they were very, very concerned. They were very apologetic, and, it was a good experience. But statistics, Zobadole say for the US, they say mostly it's people in the South. Southern states, Alabama, Louisiana, Texas.
Yeah.
Yes, that they experience a lot.
And why is that? Why is that the case? Is there a slave mentality that has remained?
The predominance of the Black people, Baba ignoring us so much, you find that in those rural areas, there are no hospitals. Mm. And you find that actually in the few of those hospitals, they even have lately they've been having a lot of foreign doctors who come from especially Asia, very few from Africa, and they're mostly from the Asia, but Indians and Pakistan. They send them to the rural areas because nobody wants to go in those deep rural areas. Right. They don't fund the hospitals, they don't equip the hospitals. So distance of driving from a hospital in the rural area where in case a woman bleeds a lot, in case you have an emergency C-section, they don't have high-risk pregnancy doctors. So in cases like those, especially down South Alabama, where the racism is still so bad.
Prevalent, yes.
It's so prevalent. So they neglect them. They don't care. They really don't care. You have to be your own advocate. And even if you advocate, like I said, states like Alabama is so bad. Louisiana has the highest rate. I was reading, actually, you made me read today. But still, the income inequalities, they are poor. They can't afford this medical care. Even if some of them may have the state insurance, the ignorance is so high. Some of them just don't care because they know hospitals don't care. They just don't give a damn anymore. So what we can say, like, oh God, Kagame, it's like they lose hope in life because the system doesn't favor them, which is really, really sad. Actually, it's been in America.
Yeah. All right.
Yeah,
Thank
it's
you
really
very
sad.
much. Thank you very much as well. I'll come to Umualia and Stella, and we will close the program. Umualia, you have been listening into the conversation. I'd like to hear your take on this. How do you react to this report? I mean, hearing the likelihood of you dying as a woman, being Black, the likelihood that you can die easily in comparison to a fellow white pregnant woman, whether either during pregnancy or childbirth. Umualia? Umualia, are you there? Stella, I come to you. Oh, Umualia is here. Yes. Umualia, assalamu alaikum. And Stella is on as well. I'll have both of you as we wrap up. Yes. Good evening. How are you today?
Alhamdulillah. Okay. How are you?
Alhamdulillah. You've been listening in to the conversation here. I'd like to get your take.
I joined late though, so all those clips you're talking about, I didn't see them.
Oh, sorry. Well, the report says you are 4 times more likely to die during pregnancy or childbirth in the UK. And while the report does not mention racism, ultimately it's really what it is down to. So it's about the women, for example, going for C-sections, which might not be necessary, the postnatal care, which is where some of the problems actually come in. We've got testimonies from some people who spoke earlier talking about, for example, nurses, and then sometimes it's even Black on Black, like the Black midwives who are there postnatal, being unable to provide the care that is necessary. And some women, we've had situations where, for example, a woman was left in this particular report. I think one of the incriminating things was about that placenta that was left in a woman. She went back home complaining of pain, and she was not listened to, but she had a placenta. 3 days later, it was, they had to operate and remove it, which was, one scandalous by any standards. But there are all other cases that sort of push towards sort of racist attitudes. It's not something you have heard or seen or witnessed.
No. I haven't witnessed anything like that. I had my second baby here, but I think it was more dramatic with my first one, who I had in Uganda, than the one I had here.
Right.
I didn't have any problem whatsoever. The care was good. I can't complain. Everything went well. It was a C-section, but it all went well.
Was the C-section your choice? Did you have a say in it, or was it just recommended for health reasons?
It was recommended for health reasons, which was well explained to me. And I agreed to it because I knew the risks that were around it. So it wasn't anything just done without my consent or anything like that. I was consulted way earlier in my pregnancy, and they said this is what was going to happen because of ABC, so that I had all the information I needed. So it was
ready
fine.
for that. All right. Okay, fantastic. Thank you very much, Umualia. Stella, I come to you as a final person tonight. Good evening, Stella. I haven't heard from you in a long time. How are you? How have you been?
I'm fine, thank you. Good evening, Sheikh.
Good evening. How is the young man doing?
He's all right. He's getting ready to sit his A-levels.
Yes.
So I think May, June, they're about to start, and
Oh, fantastic. Well, what was your experience having him? Or did you not have him?
It's okay, but obviously I was a first-time mom. I didn't know what questions to ask. I don't know whether I was being neglected or whether I was being taken care of, but it's just now that I'm thinking, oh my God, maybe I should have known what questions I should have asked. Looking back, I don't think I had enough knowledge or information on what was happening and what I should watch out for and what I should really ask to make sure everything is okay. You just go, you go for your checkups, and when they tell you everything is okay, you just say, okay. You don't even ask questions. Is he like this? Is the baby like this? So I don't think I knew what to look out for, to be honest.
Right. And at which point, actually, Ibra, before I let Stella go, please prepare our final clip, because now that you raised that point, I think it is one that would be good for us to end up on, because it lays out, I did mention, probably you hadn't joined us, Stella, that in the US now they've come up with people who are called either doulas or doulas, and they are there to provide sort of support to women who are pregnant, to families regarding that. But they are expensive because they are sort of private. But because many people are not aware of even your rights, you come from an environment where it's even different. I mean, I've seen attitudes of midwives or nurses in Uganda, and it's a nasty experience. You go to Rwanda, the story is different, but you get into the labor ward and you see what happens there. Sometimes that's why, like, Baganda have got a saying, and sometimes, you don't discuss that, but the kind of stuff that happens, you go to Chirudu and rather Kawempe, and you see what happens there. It sometimes leaves you, like in disbelief. Ibra, please, let's have that last clip before I let Stella go. So Stella, you think now, listening to this, and after watching this clip, I'm sure you're going to find that there were lots of missing gaps probably in the kind of information that you received. But so far, everything went well. There was no trouble.
I had pain for 8 years in the
pelvis. You did what?
I had pain.
You had pain for 8 years?
Yeah, for about 8 years. And every time I'm in the GP, oh, you'll be all right, you'll be all right. Until I changed what they call locum, the locum GPs. Someone advised me to ask for a locum one when I did the GP surgery. And when I called her, she just recommended physio, and it worked. The exercises worked. Some physio.
What sort of pain were you talking about? Was it in your pelvis?
Sorry?
What sort of pain are we talking about?
It was just pain in the pelvis. But I believed it stemmed from the childbirth.
Yes.
Yeah.
And for 8 years, you had to contend with them. Were you taking painkillers, or what was your GP then sort of saying?
I would stand for so long. If I did not stand, I would be okay. If I was seated, I was okay. If you are standing like at the bus stop for so long, that's when you would start feeling it. Yeah.
All right. Oh dear. Well, a lot of lessons to learn in this particular situation, and especially for my male brothers, especially we gotta be there. We have to be there. Ibra, do we have that clip ready, please? Let me know so that we can conclude with this. It's 9 minutes past 10 o'clock. Ibra, are you there? Oh, Ibra says he's not host. Sister Asha, can you help please and make 75W Radio host there? Make host, please, so that he might be able to share the clips. He had already sent a message and I was unable.
Oh no, I'm sorry, I missed it. Okambiachi?
75W Radio is not host, so he's unable to play the clip, and that's the clip we want to go out with, because I think
Which one? Oh, the second. Oh, this one.
Yeah, we've got our final clip, the third clip. But you mean the 75W Radio? Yes.
Yeah.
Yeah.
I think I'm going to stop streaming if it's going to be another. Is it a YouTube clip or is it downloaded?
Yes, it is a YouTube clip. Yeah.
Okay, let me stop streaming.
You